DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining us on DocTalk today. We're going to have a really timely issue and opportunity to visit with Dr. Cassandra Olds about New World Screwworm and what the events and what's happening with that in our beef industry. Thanks for joining us. Stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodirus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. Look who I got. I got our friend and colleague, Dr. Cassandra Olds. She's a veterinary entomologist here at Kansas State University, where we're shooting the session today. And we're going to talk about New World Screwworm. And I can tell you that there's nobody that has more of a passion for flies and ticks and entomology with the beef industry. And we're just so thankful that she chose Kansas and what she's doing with our producers than Dr. Cassandra Olds. And thanks for being on the show.
Thank you. Always a pleasure. It's my favorite place to be.
All right. Well, it's great to have you. And you bring a positive energy and a lot of education. And this New World Screwworm is here, or it's in the news.
It's in the news.
And I guess the question is why is it what is it and why are we talking about it?
Yeah, so it's been in the news a lot, and we've seen a lot of really horrific news headlines and things like that. And a lot of it is clicky, right? You want to click on this thing that says man-eating, flesh-eating fly, right? And so really what we want to break down is what is this and what does it do and how can you protect yourself? So this is a fly that used to be in the United States. We successfully eradicated it in the 1960s by deploying these sterile insects that we're going to talk about in a little bit. But so what we did is we pushed it way down into South America, and we maintained it in this Darien Gap region by releasing these sterile flies. But flies will be flies. They're always trying to find a way to outsmart us and expand their range. And that's what happened. In 2024, the flies expanded up northwards, and we got the first detection of this fly in Mexico. And that's what sort of sparked the panic, is that it's now close to our borders. Latest reports say 370 miles from the Texas border, the southern border. And so what we're really concerned about is this fly reintroducing into the United States. Okay. But there are things that we can do, and there is a management plan that we're going to talk about in a little bit.
Okay, well, so as we think about this, and it was suppressed to southern Mexico, and now it's creeping north. Why would we be? I mean, obviously, we don't want to have it reintroduced, but it's causing some issues.
Yeah, and so what this is it's a myiasis-causing fly. And so for our non-veterinary folks out there, what that means is that the fly larva, or the maggot, burrows into living tissue and causes that's its habitat, right? Mm-hmm. And so what we have is any animals that have wounds on them are at risk of being attacked by this fly. So what happens is the fly will lay its eggs on the outside of the wound, and then the larva will bury themselves in and feed off this living tissue. Okay. And so we worry about it in the context of it causes significant pain to the animal. It can cause mortality if you've got high infestations. But unlike our other things that we worry about, this is not transmissible animal to animal. It's not that if you get one animal infected, your whole herd. So we have an element of control over this, which I think is important to keep in mind.
And the difference between maggots and screwworms is maggots eat on dead tissue and screwworms eat alive?
So we have maggots of all shapes and sizes, right? Our stable flies have maggots. Our horn flies have maggots. Everybody has maggots. It's just where that maggot chooses to live.
Okay.
And so that's why, because it's in the living host. And that's also why it's captured everybody's imagination, is that there's this fly maggot in living tissue.
Right.
We would be a lot less concerned if this was maggots in dead animals, right? It's alive.
We see it.
Yeah.
Okay, well, perfect. This is a great kickstart to understanding New World Screwworm. We're going to take today and we're going to walk through the, just a common sense approach to what's going on. We have Dr. Olds here. We're going to be right back after these messages.
Hello there, Dr. Nick Wagner, Professional Services Veterinarian, and today I wanted to talk about some tips for managing foot baths on your operation. Foot baths are an important piece of personnel movement on and off an operation, and foot baths are something that if they're not appropriately managed can be a concern. So one of the things with foot baths that you should do is try to make sure that you knock off or rinse off the organic matter from boots before you step in the disinfectant, and then allow the disinfectant to have the proper contact time for it to be effective. And then look at disinfectants that may stand up a little better with organic load, because again, if you're not consistently managing these, the organic load in them can cause them to not have the level of efficacy that you may want.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Cassandra Olds. She is a professor at Kansas State University. She's a veterinary entomologist, a wealth of information, somebody we utilize in our veterinary practice. Our clients love working with Dr. Olds on flies and ticks and things that are associated with cattle and disease. We're talking about New World Screwworm, and I've really kind of stayed away from this topic because it was so sensationalized, and I like to just, hey, what are the facts? And there's two sides to every story, but really we want to know about the science.
Yeah. And
so understanding what exactly does this look like, and what's the life cycle of this screwworm.
And so it's a metallic blue fly, and it's got very distinctive orangish reddish eyes. Now, I don't want people to panic, because there's other blowflies that are blue in color. In areas where this exists and is in the wild, established populations, you will rarely see an adult fly. So we don't want people to panic and worry that every blue fly they see is this New World Screwworm. You're unlikely to see an adult in the wild. So what happens is the adult female lays her eggs on the side of the wound, and so we primarily worry about animals with wounds. They can also lay them on mucous membranes, so noses, eyes, and mouths. But that's less common. Wounds where they really want to be.
Okay.
Eggs hatch within a short period of time, a day, and then they burrow into that wound. And it's that burrowing that causes a small wound. It can start with something like a scratch or tick bite, and it really causes it to expand out. And it's called screwworm because the maggots look like they've screwed there. That's the anecdotal thing that's why it's called screwworm. It looks different to what we normally see when you've got a ball of maggots in something that's dead. These are really anchored in there. And it's this, and then they feed on the living tissue, and that's what causes the wound to expand, and it will also get a straw like exudate from it, so like a seeping that from what I've been told, it's got a very distinctive putrid smell.
Okay.
Most people alive today haven't smelt it, but those who have smelled it says, "Oh, you'll know. It's distinctive." And so then they develop in this wound, and then once they've eaten all that they need to eat, they'll actually emerge out of the wound, drop to the ground, and pupate, and then emerge as an adult fly.
Okay.
And so this is the general life cycle. Animals who are infested, you'll see signs of pain. It's very painful. Humans are occasionally a host for it, and they say it's very, very painful. So animals will show signs of pain. They may isolate themselves. They may go off feed. You can also see them scratching the area, trying to get it out, licking at it. Because I would, and so it is painful, and it can cause disfigurement. But the good news is if you can get the maggots out in time, the animal recovers.
Yep.
So keeping a good eye on your animals is really what's important here, because then you identify it and you can treat animals quickly.
Yep. And then when we're talking about the life cycle, it doesn't like cold weather, right?
It doesn't like cold weather, and this is something when we'll talk about risk a little bit later. We really need to keep in mind, what is my risk? And so each producer is going to have to look at, where am I geographically? How do I handle my animals? And how do I reduce that risk? And I will caveat that this is if it reestablishes in the United States. We're not there yet. It has not been detected in the borders of the United States.
We've been very proactive.
We've been proactive. We're doing the right thing. So this is an if.
Awesome. We're going to take another break. When we come back, we'll talk about the sterile fly technique with Dr. Cassandra Olds.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimedaBiologicals.com to learn more.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. We're at Kansas State University with Dr. Cassandra Olds. She's a veterinary entomologist, which means that she works with flies and ticks and things that are vectors and cause disease in cattle. That's kind of your niche and your specialty, and we're so thankful to have her at K-State. And if you have any, if you and your state have interest, Dr. Olds is by far one of the most clinically relevant entomologists I have ever met. So tremendous work. Let's talk about the sterile fly technique and how these, setting up these sterile fly farms and these swarms that we're going to send after them, how this is going to work.
Yeah, so the really cool thing about this is that we've got tools, right? This is as potentially damaging as it is, we've at least got tools, and these tools successfully eradicated it. It's not in the news very often, but we had an outbreak in 2016-27 in Florida. We eradicated it because of sterile insects. And so what happens is it's down to biology. So they are loyal flies. So a female New World Screwworm fly will only mate once in a lifetime. This is different to a lot of our other fly species that will mate multiple times. So she only mates once.
Okay.
A male will mate multiple times.
Okay.
So what we do is we raise these flies in a lab, and then we expose them to radiation, and it basically damages the ability of the fly to be able to be fertile.
Mm-hmm.
So now you have infertile males and infertile females. We've yet to discover a way to separate them out, but we're okay because the females aren't fertile.
Right.
So what you want to do is when an outbreak is established, or even when you're trying to keep the population at bay, you mass rear millions and millions and millions of these sterile flies. And then you release them out into the environment. And this is why surveillance is important, right? These flies can only fly so far. So you want to be surveilling all the time so that you know where your hotspots are. And then you've got these wild female flies who meet all these sterile males. So you're outnumbering the fertile males. So you've got all these sterile males around. She's only going to mate once.
Right.
So she mates with an infertile male, sterile male. She lays eggs because she thinks, oh, I had a good time. I'm ready to make babies.
Yep.
They're all sterile. So you crash the population. And this is how it works. Now, you know, we talk about releasing millions of flies. Again, people don't need to be concerned because on the grand scale of the area, again, you're unlikely to, it's not like you're going to have swarms of flies entering your household. You will never see
like flying monkeys coming over the top of your house.
You are never going to see these sterile flies that are released. And we don't need to worry about them because the females that get released are sterile anyway.
Right.
And so it's really this approach of surveillance and then releasing these flies that is very, very effective. Now, this costs a lot of money. And this is something, you know, things fall out of favor. We eradicated it from the US. We stopped caring about it. And then you start looking at budget lines. Well, do I want to pay for surveillance? Do I want to pay to support these facilities where the flies are? Yeah, we want to keep giving our money to that because if we don't, the flies come back. So it's about keeping them at bay. So the plan is now to increase our production of sterile flies, increase our distribution efforts, and limit animal movement. But bearing in mind, wildlife can also be impacted by this. So animal movement itself is not going to solve the situation. It's really flies and surveillance. And that's the plan right now.
Well, and we've done a great job of surveilling. We know where it's at. We're building these facilities.
Yep.
And thank goodness we're getting on top of it.
Yeah. And, you know, it's hopefully we'll manage to push back the population back to where it was. It was pushed back there because it's a narrow geographic area, so you can really be targeted. And so that's the thing. Something to keep in mind is if, and this is again an if worst case scenario, it reestablishes, it's going to, flies are determined by climate. And so it can survive year round in areas where it's warm enough.
Yep.
And so that's sort of our southern pockets of the United States. For the rest of the United States, it's going to be like all our other fly issues. It's going to be a summer problem. Right. But it will take time it's not like next year we're going to have the whole of the United States covered by flies. Hopefully push them right down and it becomes a non-issue. Worst case scenario, we do have tools to manage this. And then it will become fly management like the rest of our stuff.
That's awesome. We're going to take a break. When we come back, we'll do a wrap-up with Dr. Cassandra Olds on New World Screwworm.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson with Dr. Cassandra Olds. We're at Kansas State University where Dr. Olds serves as a veterinary entomologist, specializing with flies and ticks and cattle. And she made a joke offset. It was saying we're just flying right through this. So it was quite we had
a good chuckle.
Yeah, this is good. So as we fly through this topic of New World Screwworm, how do I reduce risk as a producer and what should I be looking for that's suspicious?
So the thing to keep in mind is that wounds, right? Wounds are required for this fly to complete its life cycle. So we want to be really careful, especially in summer. Dehorning, castration, carving, anything that induces a wound, even thorns, right? So keeping a good eye on our animals, and I know sometimes it's hard. We've got large ranges and we kind of kick animals out and see you again. But, you know, if this does establish itself, we're going to have to start paying more attention to these practices. Yeah. So reduce risk by managing it. The second thing that we really want to think about is, what is my action plan, right? Surveillance is important, and we're most likely going to see it first popping up in an animal.
Right.
So producers need to start thinking about, okay, what do I do if I see something suspicious? So first things first is you've got to get your action plan thought up and ready now. So if you see an animal that has maggots in them, you're going to want to submit a sample. But before you even do that, I want them to reach out to their veterinarians. Make sure you've got a good relationship with your veterinarian. Your veterinarian is going to be the one who helps you remember what number form it is and where does it need to go and who do I need to go. You guys are trained to do this. Yep. So make sure you have a good relationship with your veterinarian. And this will come through time and time again. So that's the most important. That's something you can do today for any reason. You know,
yep. Make sure your veterinarian is up to speed on it. Call them and say, hey, are you on top of this? And what do we do if we see it? And I think it's important.
Yep, we need to act as a community.
Yep.
And that's really important. So let's say you see something, you see maggots and wounds. First thing, don't panic, right? There are other flies that can do this, but we want to make sure that it's not the New World Screwworm fly.
Right.
So first thing is isolate the animal. You don't want to move the animal because then you're moving the maggots with it, which is potentially bad. So isolate it. So I want everybody to be thinking, if I go out and check on my herd, do I have a way I can isolate an animal?
Yep.
Because you don't want to have to search for it again and you can have maggots drop off and all sorts of things. So do I have a way that I can contain an animal and restrain it so that I can take these samples out?
Yep.
You're going to want to take out all the maggots out of the wound, every single last one of them. So do I have ethanol, 70% ethanol, and that can be isopropanol, it can be ethanol, 70%. Do I have bottles and 70% ethanol in my truck? Do I have some gloves? Do I have some tweezers? Because you don't want to be driving back to the house and coming back. So make sure you have it. Do I have a marker pen? So having your collection kit, you're going to want to take all those maggots out of the wound and put them into the ethanol. The ethanol kills them. We don't want to be leaving anybody behind or alive. And when you're submitting your sample, you really want to make sure you get from that core of the maggot mass, because other flies that can also cause myiasis will lay their eggs once this wound is all putrid, because it smells like something's dead.
Yep.
So they collect to it. And then you are going to submit that for identification. And this is why you want to work with your vet. So there is the form that needs to be filled in. So VS, I had to write the number on the board because I always forget. So I'm going to read it. VS 5-38.
Yep.
Your vet will know what this is because it's the same form, I believe, that you guys use for submitting other things.
Yep.
Right? You're going to want to take good notes. Location, age of animal, has it had any history of movement? And that is going to be submitted to the veterinary diagnostic lab, the national one, for identification.
Perfect.
And that is what is important. I don't want people to be so concerned about it that they don't report it when they see something.
Right.
We have to act as a family here.
Yep.
Right? So having good relationships with neighbors, having good relationships with veterinarians, you're not going to get shut down because the fly happened to fly onto your land, right? This is...
Yep, and we have to fix it.
We have to fix it, right? And I would be very upset if my neighbor didn't say anything and then all of a sudden my herd is impacted, right? So we want to be good neighbors. And then finally, this is the good relationship with your veterinarian. Call him out to look at the wound, because you have to get that wound dried, cleaned, and taken care of, because you don't want more flies coming to that area. So...
Yep, and they may need an antibiotic.
May need an antibiotic, yeah.
Whew. Unbelievable information. Yes. Thank you so much for spending time with us. Remember, always work with your local veterinarian. If you want to find out what we do at DocTalk, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson with Dr. Cassandra Olds, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.